Here is a video on the V60 BIPAP. It's your training video. I'm going to be going and following off the BIPAP, the V60 cheat sheet. So I'm going to try and go through all of your steps on here and walk you through it, just in case you have any problems setting it up. So the very first thing it says is that we're going to find our physician's order or our standing order. What you want from that is to have the physician give you a target tidal volume, 400 or 500. Have them give you a respiratory rate, usually that's 10 to 12, and then have your target sat range. You want to have that greater than 90 normally. So the very first thing we're going to do then is plug the machine into a red power outlet. Find that red power outlet and plug that machine into it. Also make sure that you're plugging that oxygen into the green outlet as well. Then it says turn your BiPAP on. That's located on the bottom left-hand side. Push that button. Okay, this is the first screen that pops up. You're going to want to hit your menu tab down here. All your tabs are located at the bottom, and all your patient readouts are up on top. So I hit my menu, then I want to hit mask and port. Now you want to find your mask that you're going to be using and find the number value that's on it. You can see right on the elbow that there's a number 1. So I want to select my number 1. Hit accept. Now you're going to be selecting your exhalation port, and we always use the DEP. That's your disposable exhalation port. So hit accept on that. Once you do that, you can hit your ST settings because you're going to be putting in your settings for your BiPAP now. We start everybody off at 9/4. Those are your minimal settings. You notice that there's a difference between 5 of those numbers. We do not want to go any lower than 5, but we can go much higher. You can have a much bigger difference to get that tidal volume. Now you want to make sure that you have the appropriate mask, and we'll go over the mask fitting. So once you have your different masks, take out your guide and measure your patient. So I'm going to take that guide out, and it will show you a reference on how to size your patient. You want to have that mask up on the bridge of the nose, and the bottom part of the mask should be in between the bottom lip and the chin. So what you're going to do is hold this up to their face. If the bridge of their nose fits in here and the bottom piece goes in between their lip and the bottom of their chin, then you've got a good sizing mask. If at any time this bottom part is up on that lip, it's too small of a size. You need to go up to that larger one. You're going to be taking your mask out of the bag. Make sure that you take the back piece off. Also on the foam here, there's going to be a little plastic piece. Make sure you're taking that off as well. So when I first apply the mask, I don't tighten it right away. I let that patient get comfortable with the mask. So I'll set it on their face and I'll hold it there in place, and I'll tell them to take a couple slow deep breaths. Try to get acclimated to the machine or the mask before you put it on. Once they're comfortable with it, go ahead and slide that on. You can see that the clips, all they do is they just go and you just push them on. To take them off, you just put a finger behind it and just pull it off. Okay, that's super easy. So now that I have everything ready to go, I try and tighten at the exact same time and go back, and it's not too tight. It's very small increments on tightening it. Once I think I've achieved a good seal, I'll look at my machine and see where my seal is at. The optimal leak is 10 to 30. If you have a leak of 0, it's too tight. Start loosening these up a little bit. Skin will break down really fast if you have a leak of 0. Also, on the opposite end, we don't want to have a leak greater than 60. Our machine cannot compensate over 60, and you get false readings on your tidal volume, and the machine is not going to be working appropriately. Now that we have our mask fitting well, we can move on and do our settings. So we always start at 9/4. Those are our minimal settings. That'll make the patient most comfortable, or that'll help them get acclimated to the machine a lot faster. Now you can see that the patient is only giving us a tidal volume of 254, and let's say our physician wanted us to have a target tidal volume of 450 to 500. So our IPAP is the one that's going to control our tidal volume. The larger the IPAP, the larger the tidal volume. So let's start increasing that. Normally it's 1 to 2. If we still need to go up by 200, let's increase it by 2. So I go up to 11, and I allow that machine to give a couple breaths, and I see what our tidal volume is. You can see it's starting to increase. We're getting close to that 300. It's still not close to that 450. So I'm going to increase it a couple more. I'll just go to 12. Just went up by 1. We're 337. It's slowly starting to climb up. Those lungs are starting to recruit already, and I'm seeing a significant change in the tidal volume. So we're still not there. Let's go up to 14. And I usually wait a couple breaths because it does take some time for those lungs to recruit. And now you can see we're up to 412. Our next breath might even be a little bit bigger, 430. So we're getting darn close to that 450 mark. And it's plus or minus 25 to 50 each way because we all don't breathe the exact same breath every single time. So I allow at least a 50 ml swing each way. So now we're in our range. We're 465. So now we can move on. Now we're going to look at our monitor and look at our oxygen saturations and see what they're doing. And our patient is currently satting only 85% despite being on 100% oxygen. So our only other option is to turn up our EPAP. Our EPAP is going to also control our oxygenation. EPAP is the exact same thing as PEEP. And PEEP is a recruitment maneuver. That's part of the volume that's left over in our lungs that allows for that gas exchange. So if I turn up our EPAP, you're going to notice the difference between the two is going to go down. So we do have a pressure support of 10 right now, and that's the difference between your IPAP and your EPAP. That's giving us our tidal volume. So if I turn up our EPAP, our pressure support drops, which means I need to increase our IPAP by 2 as well. So now we have a pressure support at 10 again. So remember that. If you turn up your EPAP, you have to turn up your IPAP as well to maintain that tidal volume. EPAP does not work right away with your oxygen saturations because it is a recruitment maneuver, so you need to give it some time. I'm going to give this 5 minutes, and then I'm going to check my sats again, and I'm watching it slowly climb back up, and now we're satting 90%. So 16 over 6 is giving us our appropriate tidal volumes, and it's also giving us a saturation reading greater than 90. So now I can move on. We're going to set our respiratory rate. The physician wanted a respiratory rate of 12, so I'm going to keep it at 12. FiO2, we always start at 100% and wean appropriately. So once that patient starts satting in the mid to upper 90s, I'm going to start titrating that oxygen down. I want to try and get them off as much oxygen as I possibly can. I time. That's how fast your breath is being delivered. That only works on a machine breath. So if it's a spontaneous breath, it does not work. Your patient is allowed to determine their own I time. Rise. This is a fun little one to work with. Let's say you have a patient that's very anxious on the BiPAP and they're just not comfortable. They're feeling like they can't breathe despite having the appropriate tidal volume. So what I do then is I will change my rise. This is going to deliver a fast breath. If I go to 1, you can see on this little figure right here, it's a really sharp incline, which signifies a very fast breath. I'm going to hit accept, and it's going to deliver a fast breath. 2 things usually happen. Either that patient feels very comfortable that they're getting that really fast breath in, or they're going to say it's way too fast and it's actually harder to breathe. If you have that patient that says that's uncomfortable, I do not like that, turn it all the way to a 5. That's a nice slow breath in. So we hit that. Now it delivers a slow breath, and that patient's back to feeling like I cannot breathe again. That's way too slow of a breath. 9 times out of 10, I end up right back on a 3. I hit accept, and now my patient feels like that's comfortable. It's allowing them to have a little bit more control over the situation. This is a scary time for them. They're on a machine that's helping them breathe. So that's how I use my rise. I'll move that up and down to try and make that patient feel a little bit more comfortable. Now you're also going to see this little icon over here, this tab. That's your ramp. We generally do not use a ramp. A ramp is used to slowly build up that pressure for patients. In a critical setting, we don't generally use it, so I won't talk about that. Also, now is a good time to point out that if you get the BiPAP initiated, or say you take over for a patient, or if you take over for another nurse on the night shift, and you change some settings, you can see that my tidal volume has gone down a little bit. So that patient may be getting a little bit more stiff, so you need to do something about that. We do have ranges of 450 to 500, and now you're only delivering 411. The way to change that is, remember, your IPAP controls your tidal volume. So let's turn up our IPAP. Let's see if we can achieve that 450 again. So I turned it up by 1. So now I have a difference of 11. I do wait a couple breaths to see if it doesn't recruit. And you can see it slowly going up. $432. I'm going to give it a minute. It may go back up. Let's talk about the next things. Alarm settings. So let's go into our alarms, and we keep the high rate at 40. Our low rate is 1 above our set rate. So we're set at 12 currently. We would want to change this to 13, so then the machine will go off. I have it at 12, so my machine doesn't alarm while we're doing our testing, or while I'm doing the video. So this would normally go up to 13. Our high tidal volume is 1,000. Our low tidal volume is 200 below what we want to achieve. So if we're 450 to 500, we want 200 less than that. So let's just go up to 250. Now, your HIP. Your HIP is your high inspiratory pressure. We keep that at 20, just in case our patient wants to take a nice big deep breath. That's okay, we'll get a high pressure. Or if your patient starts talking, the machine may trigger if it's set lower. So this allows that patient to still talk while they're on the BiPAP and not have that alarm go off. Our low inspiratory pressure, we want to set that 2 below our IPAP. Down on the bottom, you can see what our active mode is, and you can see that our IPAP setting is 17, so we want to go 2 below that. 15 and hit accept. Now, our low minute ventilation, we keep that between 2 and 3, and our low inspiratory time is 20 seconds. So if we have a leak somewhere or a low inspiratory pressure, it allows it 20 seconds to correct itself. If it does not happen within 20 seconds, we get an alarm. Okay, now we'll talk about nebulizers and their setup. You can currently see that this is our disposable exhalation port, and that has changed a little bit. I just wanted to show you. It used to have just a little hole and then it would blow air. Well, now it's a big old opening. This allows us to put a filter on there. So when your patient exhales, this just goes right out into the air. Now we're allowed to put on a filter, so it'll filter that air coming out. So when you see that, you cannot tape this up or plug it up. That's how your patient is exhaling. But I just want to touch on that. Nebulizers. You're going to grab out of your bag the blue T-piece. The blue T-piece is going to go in between your circuit, your tubing, and the mask. Okay? So it's going to look like that. You're going to grab your neb cup, just like you normally would, and it gets plugged into the bottom. Put that in the bottom, then you would just run your tubing to your air or your oxygen, and run that at 8 liters until you don't see any more medication in there. Usually it's about 8 minutes. Now, if your patient wants to eat and they're on the BiPAP and they're hungry and they're on relatively low oxygen levels on the BiPAP, then they can be just taken off the BiPAP and stuck on a nasal cannula, either a high flow or a regular setup. You never want to try and give your patient a drink of water just by taking off one clip, sticking the straw in their mouth, and then allowing them to take a drink. This mask needs to be completely taken off. Allow them to have their drink of water or whatever they want to eat. Allow them to swallow that. Once they don't have anything in their mouth, then we can reapply the mask. And then you're good to go. If they're going to be off for a while, I don't like to take the Velcro all the way off. It's already set to their face. Just pop these things off and take that mask off completely, and then stick your machine in standby. Now let's say that you have to transport your patient down to the CT. This machine transports super easy. All you have to do is unplug it from the wall and unplug it from your power outlet. This has a 6-hour battery life, and on the back you're going to see that it has oxygen tanks on the back. All you have to do is turn one tank on at a time, and there's no regulation that you have to turn, no dials. You just turn one tank on at a time and you're ready to go. If this tank runs out, turn it off, go to your other tank, and then turn that one on. Simple as that. Now if you want to add humidity to your BiPAP circuit, which I recommend doing, it's super easy. We got new heated circuits. Our water goes into here. So what you're going to do is grab this, undo it. There's your end. You're going to open up your bag and stick it in on the green side. Once it's on the green side, it'll be flowing into your little hot pot and giving that humidity. If your patient says that they're feeling really dry, you can also turn on your heater, and there's a plug on the back. I'm going to plug that in really quick. On your actual heater, the on button is on the bottom right hand side. There's two settings to the heater. You're going to have an invasive and a non-invasive setting. The non-invasive setting is the setting that I like to use. You don't get much rain out within your circuit, and it's more comfortable. It's automatically defaulted up here to the invasive mode, which is going to put on a lot of heat. So what I do is you just touch that top right one, hold it in until you hear the beeping again, and it will signify at the bottom there that it's on the non-invasive side. And that's how you run your heater. One quick tip about the heater: if you're going to stick the machine on standby for a long period of time, make sure that you shut off your heater as well. You can end up burning that little hot pot down there. So every single time, if the patient only wears it at night, then you're going to stick it on standby or turn the machine off completely. Make sure that you turn this off. It will beep twice and that display will turn off. Now make sure that you chart the BiPAP every 2 hours. Also, if you make a change on the BiPAP, make sure you're charting that change as well. Every 2 hours you want to do a complete assessment of the BiPAP, where you're getting all your readings out here and all of your tabs that or all your settings down here. The flow sheet is called RVH BIPAP flow sheet. Now let's say you ended up making that small little change and you went up by 1. You don't need to do a complete check. Do one that signifies that you changed the IPAP because the tidal volume was lower, and after you changed it, what the new one was. On to troubleshooting. On our little cheat sheet, I do have a troubleshooting page, and it describes what type of alarms you would see and what to look for. The most common ones are high pressure alarms and that proximal line disconnect. We see that one quite often too. There's this little tiny tubing right here that connects up here, and there's another one that connects by the mask. If that gets unplugged, we get that proximal line disconnect. Also, we get that high pressure alarm. We get that because the patient's coughing or talking. Those are the two most common ones that we see. If you have any other further questions, feel free to give the RT department a call and ask them. And if it's your shift and you're working and you're running a BiPAP and you got a question, do not hesitate to give us a call. All right, thank you.